It's widely publicised that healthcare costs are rising in both the public and private sectors. The challenge for healthcare organisations is to do more with less. How do you see effective talent management, recruitment and staff optimisation help to achieve that?
I think the first step is actually understanding how much and where those costs are coming from. Is probably the first step, in terms of managing it. And I found that with one organisation we're working with, and this is supported by the literature, the cost to turn over a nurse in Australia ranges anywhere from around $40,000 up to, some literature says $60,000. So you think if we've got turnover of around 7%, that's a huge impact to the bottom line. We can understand how much that may mean in terms of a loss of knowledge and those types of things, which we can't put a dollar figure on. But how much does it cost to recruit and replace that person? How long does it take to skill that person or have a skilled replacement for that person if they've had 20 years experience in a particular area? So for us to be able to really drive bottom line results, we actually have to have the right skill, keep that skill and continue to grow and develop it. So Mark, I think for any healthcare organisation to rise to the challenge of having to do more with less, there's key things that they need to focus on, and that ranges from ensuring that the organisation is aligned from top to bottom in terms of what it is that they want to achieve, how do they want to achieve it, how do they engage staff in that process, and do managers and their leaders within those organisations have the skill and ability to continually do that, because we understand and know the impact that staff engagement has on patient safety and quality. We also need to make sure that we recruit correctly, that we're recruiting the right staff, the right numbers, but more importantly the right skill mix to meet the challenges of the increased complexity that we're seeing in the healthcare environment. And performance management, accountability, ensuring that we're holding people accountable. We've got great systems and processes in place to ensure that all staff are aware what it is that we're expecting of them. They're held accountable to that. They have great conversations. They have development plans in place to ensure that we're achieving what it is we want to achieve, whether it's an internal driver through our strategic plans, or whether it's complying to national standards, or ensuring that we're complying with the accreditation processes, whether here in Australia or in Asia, etc. So I think there's a multitude of, and it's a multifaceted approach for an organisation, healthcare organisations today, to ensure that they're delivering what they need to do. It is so important, because if we don't get it right every patient every time, we're putting patients' lives at risk, and ultimately that's what we're here for, is to deliver great patient care to our communities, to our families and our friends.